On our next episode of Diagnostic Guru, we are speaking to Desiree Hollemon, a clinical development strategist focused on medical devices, diagnostics, and therapeutics. Desiree holds several patents and authorships in peer-reviewed scientific publications with a focus on global clinical adoption of new medical technologies. Desiree holds dual masters in nursing and public health and a self-proclaimed science nerd and innovation addict. Words to my heart. These are the two things I can relate to, and one of many reasons as to why we invited Desiree on our episode of Diagnostic Guru today. Welcome, Desiree. How are you?
I'm great. Thanks. Thanks for having me.
Well, I like to start out all of our conversations focused on you and your incredible 20-year history in clinical science and innovation. Could you pull out one key area in that career of 20 years that you are most proud of?
Yeah, I can. It comes from a really early experience I had when I was a critical care nurse. I think all of us want to do something, especially as you get further along in life, you reflect back on what you've been spending all your life energy on. But we all want to do something that makes a difference. And so I actually had a family of a child I took care of that had a really deadly infection called meningococcemia, where I worked with her for 16 hours straight in a shift. And didn't think anything more about it because that's what we do, right? When we go in and take care of patients. And later they came back and visited and let me know they named their next kid after me. So I thought that was sort of a drop the mic moment in my 20s that I was like, okay, doesn't matter what else I do in life. This is enough.
Yeah,
So something that I really, really treasure.
that's amazing. And think about it, the baby was like their first into the world and right life, and you're like the first human really that they probably she was exposed to and had all of that sort of personal touch moments with. So what a sweet story.
Yeah, yeah. It's something I really do treasure.
So do you know, have you have any idea where she is today?
I don't, but she's really old. So like she's got to be like 30 years old by now.
Isn't that incredible?
Yeah, I hope she's doing great.
Well, hopefully she's listening at some point to this podcast and she finds out who you are and you guys can reconnect someday.
Yeah, you never know.
Oh, that's fantastic. Well, let's start at the beginning of your career because that's really the foundational training of who you are and where you began before where you are today. I mean, you started as a trauma nurse, which I can't even imagine the stress that comes with that. But could you talk about your career trajectory, like how you finally did pivot into clinical affairs and what inspired you to kind of go in that direction and leave the actual hospital practice in general?
Yeah, yeah. Thanks for asking. Early in my career, I was, like you said, it is sort of a nerve-wracking place to work, working in trauma. There's a couple of things that you have to really master yourself and your response to things under stress, so you get used to working in that environment. But you never totally get used to it, right? I always had anxieties about performance. Like, am I going to be able to get it together? Am I going to pay attention? Am I going to remember the right things? And so that's always been a struggle. And so the way I cope with that is you also have to interact with a lot of technology. So whether it's physiologic monitoring, there's different types of pumps, there's mathematic equations you have to do for drugs, all these things is to just learn the heck out of it. Just learn it cold so that when the time came, at least I didn't have to worry about setting something up the wrong way, right? Just so I knew I had it. So then I came to really understanding the technologies and being pretty good at using them and became a resource, and then moved into the ICU where that was even more complicated and more things happening with technology. And did the same thing there, became a clinical specialist in the ICU and started doing evaluations for device companies for things like a critical care crib and, Philips doing new monitoring. And then I got into non-invasive physiologic monitoring and doing some translational research with the Department of Critical Care. And so I really, really appreciated the thought and innovation and creativity that went into something that seems fairly cold, right? Just, science. And it's not necessarily like that. And there's an interface between the bench and the bedside, or the creator, the engineer, and the patient that I always thought was a really kind of critical space that I could relate to both sides. So I decided that I was going to get out of patient care and go into working in an industry. So I took the leap and went into drug development, drug and device development at a particular company, and really loved that. Really still love that sweet spot between the scientists and the patients, and then the translation of all of that into clinical trials so that you can show it's safe, effective, and passes all the regulatory tests. So that's how I got into this space, and
Mhm.
I've just been pretty opportunistic in terms of what opportunities I thought were going to give me that opportunity to stay there, but at the same time have other things that I could do, like growing teams and working in spaces where you may not know exactly how you're going to make this work, right? And then you work together and figure it out, and then figure out how to work it into a market and reimbursement and all of that, and hopefully have success commercially in the end. So I really, really enjoy what I do.
That's so cool. I mean, science is such a fun field, isn't it? I just love all the questions, the whys, and you don't always have the answer.
Right. I could ask why probably till the end of time. Every answer is comes followed by a why, but why, and
Yeah,
like,
yeah.
kind of like a classic little kid response. I don't think that ever goes away. At least it hasn't for me.
Well, I have sort of a two-part question for you. It's really focusing more on the product piece and how you decide one, which companies do you find exciting to work for based on the product? Like, how do you vet that product? And of those companies that the products that you've worked on, which one do you think is you're most particularly proud of that you would like to talk about today?
Oh, that's a good question. Both of those questions. I'll start with the first one. So the way, and again, I am very much an opportunist, and so far my instincts have been good. So I hope, cross my fingers, that continues. Um, the science behind what the concept is or what the early stage data is. I'm a big data driven person, and so I don't mind taking risks, but I want to make sure that they are well informed risks, right? So that I do understand where the holes may be in what their methods are, or where they think they might need to change, strategies or whatever. It doesn't have to be perfect, but it has to be pretty solid going in. And then next after that is the people. So if it's not, if they aren't, they don't have to have a huge track record, but they
Mhm.
need to be people that I feel like I can work with up front. It doesn't always, I've turned things down because the technology was amazing. It could be transformational, but the people weren't right. So
Yeah.
for me, I really want to have good collegial relationships where I have a seat at the table, where I'm able to contribute as much as I possibly can, and that they're receptive to that. And so the match there is really important. And then the second part of your question, what am I proud of?
Yeah.
Um, I spent about, I think it's 8 years working in with cell-free DNA
Mm.
diagnostics, way back when we were looking at proteomic testing for prenatal diagnosis. So we were doing the quad test and other tests where it was just using, protein expression, but still a blood test, but then confirmed with amniocentesis. And I was able to go straight from a company doing that to one that was doing cell-free DNA applications, called Ariosa. And that group of people was amazing. Ken Song, that was the CEO there. Tom Musey was the CMO there. And the science team that built the assays and rebuilt the assays over time. It was just such a great experience. And when I joined, I think I was employee number 13, they actually had to scrap the original assay that they had, started the company with and rebuilt it.
Wow.
And it was a smart thing to do. So I think they were a really smart team about assessing what really needed to be done, and not spending time where you shouldn't spend time. So I'm really, really, I run into women that will tell me, oh, I've had that test. I have a daughter who just finished her MPH, and she was taking a genomics course, and she went up there and she goes, "Oh my gosh, my mom made that test. They actually were presenting it's called the Harmony test, and they were presenting it in her class." And she was like, "My mom's, on that paper." So yeah, I feel really, really satisfied,
Yeah.
that we were able to do that with the team that we had and the technology. So yeah, I'm super proud of that.
Well, you were at a cutting edge company at the time. There was a small subset of competitors there, right, for NIPT
Yeah.
testing. And it changed how OBGYNs do prenatal care. I mean, it took a long time to get there, but now it's standard of care, which
It's
is
standard.
incredible.
Yeah, and I think the whole concept of cell-free DNA as a diagnostic, in my career, it's been a game changer for oncology. For example, I was doing breast cancer
Mm,
vaccine work, and we were having a hard time detecting minimal residual disease. And I remember thinking, I was also doing some consulting with cell-free DNA oncology, and I was like, this is what we need to be doing. We need to be
yeah.
doing this blood test to determine residual disease, right? The residual disease degree and all that. And sure enough, that's what the standard is. So if it didn't take that much time for it to make such a leap into regular care.
Oh, what is your favorite part of your current role today? And what is your least favorite part of
Um,
your role today?
um, my favorite part, and I think it comes from kind of getting older, is being able to share, I don't know if I call it wisdom, but experience with team members that I work with now. Like sharing, I feel like if I had known what I know now, I feel like I could have had an even better career. And so I really do find sharing information about just how to develop yourself, how to develop your career, how important self-awareness is, um, how to manage up, how to work within a political environment in a company, how to influence people, all those sorts of things that over time you sort of stumble into and figure out. And I just figure if I can help, I have work with a team right now of all women. I'm like, if I can help someone who's in their 20s and 30s, maybe, start to learn some of the things, become aware, they can start practicing it. So maybe their trajectory will be
Hmm.
faster and better or take them where they want to go.
Yeah,
So yeah, I really
that's
enjoy that.
that's amazing. Yeah, I mean, it's hard to find female mentors who are genuine, right? Who truly do want to help. I mean, I think some of us have had those experiences. Some of us unfortunately have not yet and are still looking for that. Do you also mentor outside of your workplace as well?
I've done some mentoring with women in med tech and that's pretty satisfactory too. It's always nice. I mentor my daughters,
Oh yeah, of course.
so
Yeah.
that's good. Um, But yeah, I think it's really important for us as we move in our career to help people understand, lessons learned, right? I mean, some lessons I learned the hard way, and I never really had anybody give me like direct feedback until I really paid for it myself with doing my own executive coaching. And then I realized, wow, like this is so valuable. I think as women, sometimes we just aren't given direct feedback. And I think we pay a price for that over the lifetime of our careers. So I do try to integrate that into the management and mentoring that I have. It's good to be self-aware and know where your strengths and where your challenges are. And most things are solvable if you're open. If you're open to learning and you're open to improving, nearly everything is solvable. As far as what did you say, the worst part or
Or
the
the least,
the
maybe least favorite. Yeah.
least favorite? I am perpetually struggling with my own time management. I think
Mm.
that we are so overburdened. I feel like that we have so many things coming at us. I think like even in my current position, I have so many competing interests, so many things where I could put my time, and they're all relevant and important. So yeah, I think that is something I still struggle with. If I could invent something that would help me stay on time, like with meetings, so I don't forget things, because I get very focused and absorbed. I swear, if it were even a shock, I would take it, to keep me on track. Somebody ever develops that. There's actually a sleep device that will shock you, to get you awake.
Oh my God.
You put that on
I
my
don't
Apple.
have that problem. I wish I did.
Yeah, so I gotta talk to Apple. They need to add a shock feature on
Yeah,
watch.
exactly.
But yeah, I think and lately I've been experimenting with, how to manage my time better. And there's a book that I have gotten recently called what's it called? Um, shoot, it's about focusing and picking like the top three or four things that you're going to focus
Mm.
on
Yeah.
and just trying to put your energy where it's going to have the most impact. So yeah, that's the least favorite thing. It's just the whole time struggle for me.
Oh, wow. Well, I think a lot of us experience that, especially being career moms or no matter where you are in your journey. And
Mhm.
there's just so much out there now. I feel like today that we have access to. It's like, oh, like I get so
Things are
distracted.
distracting. Yeah, all the streams of information coming at you at work,
Yes.
from Teams and Outlook and phone calls and texts and
Oh yeah.
all of
Yeah.
that. Yeah.
I could spend my whole day managing just it's either t Slack or Teams. Like that's I spend my
Yeah,
whole day on that and
for
I
sure.
never get to my emails. I'm like, I always tell people like those are for the end of the day. If you need me right now, just instant message.
Yeah, and then you start to get people do what you ask and they text you and then you get like these long text
Yeah. I
messages.
call those mom texts, no offense, but
Oh no, still in a hole.
yeah. I'm really intrigued by the painting, or it's an image, I think, electron microscope image behind you. Is that a
Yeah,
skin and epidermis, or what is that? An
exactly. That's what
HD
that is.
stain?
Yeah, I
Oh,
looked up when I first had this office, I looked up where I could get science art, and
oh,
so I
how
have
pretty.
some random like pictures of nerves and skin cells.
That's
Told
so
you I was a
cool.
nerd.
Yeah. Well, that's good. You're in good company. So I'm impressed with myself that I knew what it was.
You did. You nailed it. That's exactly right.
Well, back in the day, a lot, graduate work, we used to do a lot of H staining,
Oh
slide
yeah.
staining and stuff. So it all comes back to me. And it's still traditional method used in pathology today to diagnose,
It,
right?
it is,
Diseases.
what's really fast. So this is the coolest thing I'm very excited about, like new technology, is the bright field analysis that they can do with AI
Mm.
on
Yes.
pathology. That's the coolest thing. I think it's super cool.
Yeah. And it's all automated now, right? And it's
Mhm,
fully
mhm.
digital. That's, yeah.
Yeah, and the image quality is outstanding. And so we're actually using that on some of the studies that we're doing, looking at nerves and neuropeptides and staining them and having the AI read them. It's very cool.
Oh, that's amazing. Yeah, I mean, you still need the human at the end of the day to do the final diagnosis, obviously, but at least the AI points you to the exact zone of the
Yeah.
imagery, right? To look at.
Yeah, it's much more efficient. Once you get used to it, it can
Mhm.
be more efficient and, maybe more accurate depending on how the system works. But yeah, it's good.
Yeah, no, it's definitely changed, I think, the pathology field in general. Well, the whole premise of this podcast is we like to dig in a little deeper, on your trials and tribulations. So, could you list for me and those that are listening, what's your one good, one bad, and one ugly?
Whew. Um, let's see. I mean, I think my one good is that I'm in a field where curiosity is welcomed and
Mm,
sometimes rewarded. If nothing else, it's fun, right? I love development, and I love innovation. And so I'm super happy in that space. I think it's a creative outlet for someone. Like I am a nerd, but I feel like this is a place for creativity,
mhm.
as well. And so that's cool. I like that. I think the bad. I don't know. I think that's a tough one. I don't know that there's that much bad. I think just conducting research in general, you can do really good research in industry. And
Mhm.
I get kind of discouraged because, sometimes you're not allowed to be on publications because it's considered potential conflict of interest. So all your work from concept to execution to interpretation and writing, you don't get to follow that along in some areas, not all the time, but sometimes. And so that's tough, I
Yeah,
think. But I mean, it is what we do, and I think it's kind of sad that industry research, despite being really high quality, and honestly, it's a lot of the research that gets done, is viewed that way by, for instance, like payers and whatnot, and so they may reject it largely because of that. Even with editorial work, it's public
hmm.
criticism. Um, so yeah, so that's a challenge, I think, that as a researcher within a corporate environment, it's.
I've experienced that. It was hard for me when I was like the head scientist and I couldn't be first author, let alone very rarely last author because it's considered bias, right? So you had to have external
Yeah. Yeah.
physicians and people who believe in the product. Because otherwise, to your point, the reimbursement, they may not accept the paper, or you may not even be able to present it at a conference.
Exactly. Yeah. And I find that change, it depends on what field you're in and the kind of the environment in that particular field. As you get more, I think, into clinical research in interventional and like, yeah, interventional studies, I think it's more like that, less like that with diagnostics, but it's a thing. So yeah, that's a frustration sometimes. It's not for the glory, it's just for
Well, it's your work.
it's your
You,
work. Yeah. So that's why I like patents. I'm like, I love getting patents. I love being on patents because it's just like kind of codified. Yeah.
yeah, I would
People
think
find
that's more reputable than a paper in some
it
cases.
depends, but yeah,
Yeah.
it's rewarding. I think for the ugly, I think, being a woman in science, I think is getting better, but I think it's been tough. Like the road has been tough. I that's why I was saying before, like I wish I had known then what I know now to be a little bit more skilled about navigating things and
Hmm.
understanding what it takes to be seen as someone who has good solid ideas, right? So that you can be taken a little bit more seriously. I think, especially as you're younger, it's even that added challenge of the bias that you can have for your being young and being female. I think that's a double whammy sometimes, and then you can add intersection of another kind of potential bias too, which is even harder. So I think, yeah, I mean, I think at one point, I even thought about just giving up and not doing it
Oh,
anymore. It
yeah.
was just too much. It was just too much to try to keep fighting for everything and um, just not getting the results or the movement that I wanted. And you have to stay persistent and just keep at it. And I think that's what motivates me a lot to help other people is like just, hey, these are some things that you just need to know
Yeah.
as you move forward in your career. And the sooner you know them, sooner you understand them, the easier it's going to be for you to navigate them.
Hmm.
So yeah, I think that's probably when I look back at my career so far, anyway, that's kind of been the ugly.
Yeah.
Yeah,
It's too bad, that you even have to get to that point where even considering of getting out entirely based on the fact of the challenges just because of who you are. It's unfair, really.
it is unfair. It is unfair, but I will say there are ways to handle it. I think
Hmm.
there are effective ways to handle it. N now I know better. Um, and you don't need permission
Yeah.
to do what you want to do and say what you want to say and make a contribution. And people eventually will accept that that's who you are and that's what you're doing here. And hopefully you'll get recognized and put in the right level of position and responsibility for that to come forward. But yeah, but overall, I think I'm quite happy with where I am and very happy with what I get to do every day and the people I work with.
Yeah, I mean, it sounds like you're not really, it's not a job. It's more of a not a hobby, but it doesn't feel like a job, right? Like you get up every day, you're completely inspired and you probably sometimes are like, wow, I can't believe what time it is.
Oh, totally. Yeah. That's why I need the alarm with the shot.
Yeah, you're so deep into your digging into the innovation, but
Yeah.
I think for me and listening to you, it's grounding. You validate the fact that there's times where you just have to be comfortable of who you are in this situation, right? And not be a jerk about it,
Exactly. Hmm.
right? I think there's too many people, even if they are aggressive, they are more mean, and that's when people don't want to listen. And so I'm sure your daughter's great inspiration there. It sounds like your one daughter's in science or healthcare. What about your other one?
My other one also, she works
Wow.
for an early stage. Well, actually, they just got it was Vertex. They just got acquired, and she works in clinical research also. So I've got
Oh,
two
wow. Look at
engineers.
her. Well, she
Yeah,
made the right choices.
she was lucky.
That never happens. Like a friend of mine, we were just talking about this the other day. These startups, they pull you in, they say, oh, it's going to be all generational wealth. And it never
Her first real job, and then boom, she texted me and she's like, "Is this a good thing?"
Yeah.
Yeah, it's a good thing. You're very lucky. Uh,
But
but
maybe she watched you and saw how you approach things because you even said like the technology is fantastic, but the people, and it's usually the people are the reason why the technology does not go, right?
that
So
is so true. And you bring up another point too, is like, okay, so what do you do when you have six, like, how do you know success when you see it, right? Or
yeah.
potential when you see it? And then there's a whole thing about navigating finances. So say that
Mhm.
you are in a company that does well and you have an exit, there's a whole lot of like understanding options and understanding the finances. And I think that leads into negotiating good offers up front, right?
Yes.
And helping people
Yes.
understand the value you can leave on the table, that you as a woman, like you need to be sure that you bring home the bacon and that you get the equity, you get the salary, you get what you need when you're looking at a new opportunity that you're worthy of, right? And
Yeah.
so I think there's like the whole thing about the business aspect of it too, that is not taught. You don't really learn that from anybody just by getting through it.
Yeah, there's times I wish I fought a little bit more for myself, but even in not just the whole compensation on it, but more descriptives of the role and do I have autonomy and authority of being a leader at that role?
That's a good point, right?
You know?
Yeah, no, that's a really good point. And I think again, that brings it back to people and trying to it's not easy to figure out from leadership what kind of leaders are they going to be, how are you going to interact? So I have a pretty short, I don't know what to call it, I'm very, very critical and when I evaluate new opportunities on that.
Mm.
Like, I think it's really, really important that you can have transparent and open conversations. And if you can't, it's an absolute non-starter for me.
Good for you.
Yeah.
You've got a really good sense. So I think your daughter, it's genetic or epigenetic because she's following you, your lead. So
I don't
good
know.
for
I think
her.
it's like knowing when to walk away.
Yeah,
Yeah.
yeah.
Hmm.
Oh, there's times where it's scary too when you make that decision to walk away. But man, when I get on the other side, I feel like a whole weight is lifted, right?
Right, right. And you think like if you think about any time where if you've had that and you go back and you're like, okay, if I had stuck with that and joined them or done, whatever, what would I have not have done otherwise? Right.
Yeah, yeah.
And realize how taxing and limiting it is if you do settle for something that's not quite right for you.
Yeah, it almost changes your personality and then it can even affect your personal life, which is never a good thing.
Right, right. It affects your personal life. It affects your potential net worth in the future. All kinds of things. So yeah, it's important to make sure you get the right choice and understand what you negotiate up front.
That's good. Well, all those young women in science, if you're listening, make sure you write that down because it's not something you learn in school, right? It's definitely a real world evidence
Definitely,
right
yeah,
there. Yeah.
definitely. Hmm.
Well, sadly, we're coming to an end. This has been a really great conversation with you, and I've really enjoyed learning your journey. If you could list what your superpower is, what would you say?
Mm. Persistence, probably, both in the good sense and the really annoying sense. I can stick with something for a very long time and I just keep coming at it from different ways. And hopefully it's for a good reason, right? It's a good idea or it's an aspect of something that is going to have benefit, but I'm very, very persistent.
Well, it's got you to where you are, and also persistence in choosing the right path versus the wrong path. So I see that as a positive.
Thanks, I hope so.
Well, we're excited to see where you land next, but it sounds like you're in a really good place. And that's the sweet spot. Like I'm always looking for something like that where I just want to wake up each day and not feel like work. So kudos to you on that one.
Yeah, thanks. I'm pretty fortunate that way, I think.
Well, thank you so much for joining us today. It's been an honor to have you, and I cannot wait to get your story out there and have others learn from your experiences. So thank you, Desiree.
Fantastic. Thanks for having me. It's been a pleasure.